Hey guys, it's Charles from In the Mess. This is the first of our quick flicks, and today I'm going to be talking to you about fluid therapy. This is an area that causes huge anxiety amongst junior doctors, but I'm going to try and distill the key things that will get you through a shift in 2 minutes. There are 3 reasons why you would give somebody intravenous fluids: maintenance, replacement, and resuscitation. Maintenance fluids, you're looking to replace their daily water requirement and their daily electrolyte requirement, and this is for patients who are nil by mouth or for whatever reason they're not able to drink fluids orally, which is always the preferred route. You need to give just enough of everything, about 1 millimole to 2 millimoles per kilo per day of sodium, the same for chloride, and half that for potassium. Most centres will have a protocol for this: 0.18% sodium chloride and 4% dextrose with a small amount of potassium is usually the way to go. It has to be based on weight. You're looking for 30 mils per kilo per day, but usually this is grouped into weight bands between which you will give a given amount per hour. Next up is replacement. This is for people who have lost some fluid, but they're not acutely unwell with it, so they're not hypotensive. Think of high gastric losses, nausea, vomiting, high output stomas, dehydration, that kind of thing. Don't need to correct this with the same squeezing a bag rate you would for resuscitation, but it does need to be done in a small number of hours. Think of what fluid has been lost and replace that. Gastric losses are salty, so it's one of the few remaining indications for 0.9% saline. If it's a patient who's just dehydrated from lack of input, then I would go for a balanced crystalloid like plasmalyte or hartmanns. Finally, we have resuscitation. This is for the patient who is so hypovolemic that they're also hypotensive. They're acutely unwell. Start with a balanced crystalloid, plasmalyte or hartmanns, whichever is most prevalent in your hospital. You have the option of colloids after this because they stay in the circulation a bit better, but they are falling out of favour. Most places would stick to crystalloids, plasmalyte or hartmanns. If it's rapid blood loss, the sooner you call for blood the better. It usually takes a while to get a cross-match. If you think they're bleeding and you're going to need it, just order a couple of units. You can always send them back. Once you get to 2 litres of crystalloid loss, start giving blood, call for senior help. There are some special situations where you would give less fluid at a time, so if somebody has congestive cardiac failure, really significant renal failure, or an altered intracranial pressure, you would want to give 250 at a time rather than 500, and make sure that you call for assistance earlier than you would otherwise. And that's the first quick flick. Don't forget to look out for a deep dive on the fluids topic if there's stuff that I've missed, because there is a huge amount. It's a really complicated topic. And as always, remember to like and subscribe this video so you don't miss what's coming next.